There are harmonized statutes, and there are other agencies, but the primary permitting of oil and gas activities, DME has that responsibility.
Have we had any situations where we have had these operations that have not protected the environment? Any situations that have developed in the last couple decades? I'm not aware of any.
Mr. Chairman, in the inspections that are done, there may be times when there would be maintenance on the road or a culvert on the road, something like that. But if the question is directed towards the contamination of surface or groundwater, there are no instances related to hydraulic fracturing. And there are over 10,000 wells that have been drilled in Virginia. About 80% of those are fractured, and there are about 8,000 that produce now. A little over 2,500 of those are in similar geology as in the Taylorsville Basin. Between 4,000 and 4,500 of those are in the Coalfield region.
Do you and DEQ have the ability now to regulate without legislative authority?
Yes, Mr. Chairman. The Department of Mines, Minerals, and Energy and DEQ work very closely in all of our regulatory programs, and we're all interested in the protection of surface and groundwater in the environment. Primarily, the Department of Environmental Quality is responsible for point source discharges under the National Pollution Discharge Elimination System. Also, if there are groundwater protection or groundwater management areas, they would have primary responsibility for permitting for those withdrawals. Generally, though, for all of the erosion and sediment control on the sites, that's covered by DME permits. Also, the protection of water supplies is under the DME permits. The code provides for the replacement of any water supplies that might be impacted by gas or oil drilling.
And I guess my last quick question is, have you been working with the patron or anyone in regards to this bill?
Mr. Chairman, we have not been contacted by the patron at all on this bill. We've had a number of folks that have asked us questions about it. We've heard some information today about informational meetings that our staff have been willing to participate in within the area. And so we try as best we can to explain the state requirements as established by the General Assembly, and also to provide technical information and who we are and what we do as part of our day-to-day work.
Make sure I heard you. I wasn't paying maybe quite as much attention as I should. Did you just say the patron has not contacted you?
Mr. Chairman, that's correct.
Thank you.
Thank you, Mr. Chair. I just have two quick questions. I think one might be for Andrew. I'm not sure. I thought I heard the patron say that on the Senate side that he worked with you all on this bill and you did not support it. I mean, you did not oppose it in the Senate committee hearing. Did I hear that correctly?
I think that's what you heard. Mr. Chairman, I would say that we voiced our concerns over the moratorium and the items that are in the enactment clause with the patron prior to the committee meeting. There were amendments that were proposed in that committee meeting, and Mr. Chairman, the patron of the legislation adamantly opposed adding those amendments to the bill at that time. So we were no longer able to support the bill.
Okay, so you did oppose it in the Senate hearing?
We were not able to support the bill without amendments in the Senate committee.
That's not my question. Did you stand up in the Senate committee hearing and oppose the bill like you are here?
Not in the same way, Mr. Chairman, because we were asking, what we have made clear to the patron from day one is that we support DEQ's ability to regulate the industry like they are now. We support DMME's ability to regulate the industry like they are now. We voiced our concerns about a moratorium in the enactment clause of the legislation and asked for amendments, and they were rejected by the Senate of Virginia.
Okay, follow-up question. Has a permit application been filed as of today?
No, Mr. Chairman, I would answer by saying no. And as I indicated in my testimony, the industry does not have plans to file for a permit this year.
Follow, Mr. Clerk, Mr. Chair. And so would you, let's just, again, bring this up 10,000 feet. This is not a question of will there be fracking or not. There will be. Well, eventually there will be. This seems to be a question of will the experts in keeping our drinking water safe have a seat at the table at determining when that fracking would be. And I don't know if DEQ is here, maybe this is a question for them, but how long would it take? How long would it take for DEQ to develop?
David said, Mr. Taylor's doing
Yeah, in the enactment clause, it lists a number of different rules that you have to review and come up with recommendations. How long does that process usually take?
No, Mr. Chairman, with the Administrative Process Act, unexpedited, it's 18 to 24 months.
Okay.
18 to 24 months.
18 to 24 months. Any regulation that goes to the EPA is generally, 18 is a pretty good number to go with, 18 months.
Okay, and a couple final question, I guess. As I understand it, this we're talking about fracking in a body of water that is the only, and whoever wants to answer me. As I understand it, we're talking about fracking in a body of water that is the only source of drinking water for a certain number of jurisdictions. Can you tell me how many jurisdictions that is?
Mr. Chairman, I can't tell you how many jurisdictions. The Potomac Aquifer is the largest aquifer that underlies all of coastal Virginia. It has the largest in terms of the amount of water that's in it. And that aquifer goes from Southside Virginia all the way up to the Potomac River.
All right, thank you.
Thank you. I think that's always the question. Delegate Stewart, Senator Stewart, always give the last word.
Mr. Chairman, thank you. The only thing I want to respond to is because I don't want you all to think that I would misrepresent anything to anybody in this room. Mr. DeJarnette, who is the gentleman who's the chairman of Shore Production, met with me. I talked with him, met in my office. We agreed to this bill. And he stood before the Senate of Virginia and he spoke in support of this bill. And Mr. Lamar was right there. I want to be very clear to Delegate McClellan about that. And I don't know what's changed between then and now, but I really am not trying to injure the fracturing process. I'm just trying to make sure we do it safely in this little corner of the world.
All right.
Mr. Chairman, I was in that meeting.
Okay, Mr.
Mr. Chairman?
Yeah.
I'd like to make a motion. Move to lay the bill on the table.
Second.
All right. All in favor? All right, members wishing to lay the bill on the table will vote aye. That's a voice vote. That's what I said, vote aye. Aye. Members opposed?
Mr. Chairman, can we have a show of hand vote, please? I can tell by eyes.
Okay, is there enough, you asking for a, raise the hand?
Yes, sir. Division.
Okay, division. All right, all those wishing to lay it on the table, raise your right hand. Those opposed?
Thank you, Mr. Chairman, members of the committee.
All right, delegate, Senator Stanley. Senator Stanley, you have a bill on the financial literacy course that was presented the other day. Did you get the attention to the question that we needed?
Mr. Chairman, we did this. Coleman Walsh was the one that spoke to community colleges. He's retired. Tracking that down, we called the community college organization associations today.
We thank the community college group here to support Senator Stanley's bill that's.
If they're not here, there's no hearing.
that was the other one. There was some reason that we were asking if there was going to be a collaboration.
The bill, the essence of the bill was this, that anyone receiving a VEC benefits claim, a financial literacy course would be offered to them, forced them to have. That financial literacy course is already offered in our community college system. Colin had done the research, he worked with me on the bill through VEC, to whereby he believed there's no impact because that could be just simply taped, put on their website, or made available by DVD or other manner of delivery systems. And his position was in support of it.
Okay.
Mr. Chairman,
Yes.
I had some questions last time about who the workforce service partner entities were, and it was talked about those community colleges, and we just wanted to see if they were equipped to handle this, and if there was any cost involved, and how they would go about doing this.
Okay. I knew there was somebody.
I had no interest in this bill going by. The chairman asked this bill to go by, and wasn't given an opportunity to say no.
I feel caught up in it a little bit of a issue between the two delegates.
Between the chairman, between the chairman and the delegate.
Oh,
You know, I don't know about that.
I'll just be behind the lectern.
Yeah.
Move to report.
I have a motion to report in a second. You couldn't get them here.
They didn't seem.
All right, they'll have, if you could, between now and the time I have to handle this on the floor for you, Senator Stanley, could you give me some information?
We'll do that.
All right, have a motion and a second to report. Members wishing to vote on electronic voting board. You go with that. All right, Senate Bill 266 reports 19-0. Senator Parker. Here's our last bill.
Thank you, Mr. Chairman, members of the committee here. This bill is a version of the teen tanning bed issue that we've had over the last couple of years. This is the more modest version of the two types of things that have been discussed this year. It does not ban it under age 18. It bans it under age 15 and requires.
This is the stripped down version.
Mr. Chairman.
This is the stripped down version.
This is the stripped down version. Yes.
Mr. Chairman. Mr. Chairman.
Yes.
Mr. Chairman.
Yes.
I'm sorry to cut, sir, but we passed a bill identical to this, did we not?
No. We killed the bill identical to this.
Mr. Chair, you are correct. Let me just go through things quickly, and you're certainly with Delegate Hugo, and fill us all in on what happened previously with those two bills that came forward. As I said, this is the more modest version. There was
anybody under 15, right?
Anybody under 15 is not allowed to use a tanning bed, and there's parental consent required for 15 to 17-year-olds. Is what's in the bill. This is Senate Bill 479. This issue was studied by the Joint Commission on Healthcare this year. The Joint Commission on Healthcare ended up recommending this more modest version on a vote of 10 to 2. It was an outstanding study done by Michelle Cheshire, who's staff of the Joint Commission on Healthcare, and she's here today, can help answer any questions that anyone might have on it. Skin cancer and melanoma is a significant issue. There are 68,000 people a year get a diagnosis of melanoma. The mortality rate is about 12-13%, so you have about 8,000 to 9,000 deaths every year that are a direct result of melanoma. Much of that melanoma is directly related to exposure to harmful radiation in one form or another. For those ages 20 to 29, it is the second most common form of cancer among women. It is the third most common form of cancer among men. So it's something that particularly affects young people to a disproportionate rate compared to others. Those who are users of tanning beds among younger people, among high school students, a lot of them are white females. It's used less by males than by females, and they're used less by other females than by white females. Under 15, about 15% of high school students who are under the age of 15, white females use tanning beds. For those 18 and 19-year-olds, it's almost 50%. It's getting close to 50%, so it's a very significant issue that results there. We in the Commonwealth already restrict the use of cigarettes, alcohol, and the types of things that are clearly pose significant risk and health risk and death, mortality risk for minors, and this would just fall into that particular pattern. It is particularly significant in that exposure at younger ages dramatically increases the risk for melanoma and for mortality from melanoma than if you are tanning whether it's in a tanning bed or out in the sun, at age 30 or 40 or 50. It prohibits all the use of tanning beds, doesn't restrict spray tans or other types of things that are used by a number of these teenagers. There are various people here who can speak in support of this. We have the industry, the citizen groups, etc.
Let's hear from the ones in support. We've heard the bill before, but we want to hear from you. Good afternoon, Doctor.
Mr. Chair, I'm Sterling Ranson, I'm President of the Medical Society of Virginia. I'm speaking today for the Medical Society in addition to the American Academy of Dermatology Virginia chapter, the American Academy of Pediatrics Virginia chapter, the Richmond Academy of Medicine, and the Virginia Academy of Family Physicians. Briefly, what happens when you're exposed to ultraviolet light is you do damage to your skin. Human skin is damaged, the DNA is damaged with ultraviolet light exposure. It's this damage that causes the tanning reaction. Unfortunately, it's also this damage that causes an increased risk of cancer. And what we worry about most is the risk of melanoma. And I can't improve on Senator Barker's data. He has fantastic data. But I will say this, for non-melanoma skin cancer, your risk, if you have been in a tanning bed once, your risk of developing a non-melanoma skin cancer increases anywhere from 40 to 102%. Okay, and that's for the non-melanoma skin cancers. And folks who are under 25 who are exposed to UV light increase a melanoma risk of 75%. Now, there are 35 states in the United States that have regulations against this kind of UV light exposure in our children. I urge Virginia to become the 36th state to protect our children from the dangers of indoor tanning. Thank you.
Thank you. Yes, sir.
Mr. Chairman, members of the committee, James Hoffman with Davis Consultants on behalf of the American Sun Tanning Association. The ASA represents the indoor tanning industry, and we support this bill. Thank you.
Mr. Chairman, can I ask you a question?
Yes, sure.
Did you support or oppose the House bill?
We supported Delegate Brink's bill.
Brink's bill opposed Delegate Yost's bill?
We were neutral to Delegate Yost's bill.
Okay.
Delegate Bell? Question? No.
Not for the speaker. I have a question when they're done.
Anybody else in favor of the bill?
Mr. Chair.
Look at me. I'm a Caucasian man. I don't do any of that stuff.
Mr. Chair.
Yes.
I'm having trouble determining what current law is and how this will change it because it's just one paragraph. And could I just ask Frank could the gentleman walk me through what current law is with regards to parental permission and what this will allow and change?
Yes, Mr. Chairman, Delegate Bell, current law is that there's parental consent required under the age of 15, and it has to be reissued every six months. 15 to 17, there's no restriction right now. What this would do is it would prohibit use under the age of 15. It would have parental consent required for ages 15 to 17, but it would be a one-time parental consent would not have to be renewed.
Mr. Chair, can I ask? Okay.
Yes.
So just so we're clear that I understand, you can't even give parental consent before, is that right? Mr. Lupasi doesn't want his kids to, I do want my kids to, but this would say that under no circumstance, even if the parent gives consent under 15, it would just not be allowed, is that?
That is correct. Under age 15, it would not be allowed.
Okay.
All right. Delegate Hugo.
Sure. American Cancer Society testified against, are they here? So they testified against this version in the House version, didn't they?
Correct. What happened was the American Cancer Society favored the Yost bill over this particular version. The Brink bill was carried at the Joint Commission on Healthcare. There is someone here.
Yes, ma'am. Come on.
Mr. Chairman, members of the committee, my name is Ann Vaughn. I'm with the American Cancer Society Cancer Action Network. We did oppose Delegate Brink's bill because we appreciated the intention of it, but didn't feel that it went far enough since 12th graders, according to the CDC, actually use tanning beds twice as much as 9th graders. So we would like to see the ban be 17 and under, but we do appreciate the intent of what Senator Barker is trying to do.
All right. Sure. Delegate McClellan.
So if given a choice between this bill and nothing, what would you prefer?
We can't support something. Our problem is we want to see the full ban, and our fear is if this if we don't get a full ban, it will be hard to come back next year and change this.
Further follow-up question. But we've had this issue for a number of years, and every year we've gotten nothing. So, I mean, do you understand?
I understand,
Okay.
I completely understand where you're coming from.
The makeup of this committee is probably not gonna change.
We would very much
All right, we got Nancy on here now. We changed a little bit. Right.
Mr. Chairman?
Yep.
So you oppose the bill, is that correct? Or do not support it?
We do not support the bill because we would like to see all minors protected from things.
Mr. Chairman?
Women Delegate Comstock.
I was going to ask, can we substitute the Yost bill for this bill then at this point?
Yeah, next year. What that bill is? No. All right, Delegate Lee.
Well, Mr. Chairman, I was just going to say there's some question about the fact that we've not been able to get the broader bill out in the past, and I'm someone who's voted against the bill, who's probably inclined next year to support the broader bill. So to the extent the Speaker continues to keep me on Commerce and Labor, I think the bill does have a better chance next year. To the extent that's what you were asking. I didn't make a motion.
Delegate Farrell.
Mr. Chairman, I would move to carry this bill over for the year.
Mr. Chairman?
Yes. Wait a minute, there's not been a second. Are you seconding?
No, sir. No.
Carry over his motion and Hugo seconds. Now, Delegate Rule.
Mr. Chairman, no one really went against this bill more so than I have in the past.
I know.
Praise the Lord. Well, Mr. Chairman, at least what we got here is a start. And I understand what you're saying about next year. We don't know what happened next year. We don't know how make up this committee to be next year. No one knows. Next year, you might be in the Senate next year, sir. You don't know that.
The United States Senate?
But
I have an announcement to make, Mr. Speaker.
But because we have something here, listen, we do have something here. This is the start. So don't carry us over for next year to try to get a better bill. But we had that the other two bills before us now. Bring the Yost bill. This is the start. So at least you can always come back and bring another bill next year to make it even better. Let's use this one right now. I'm asking y'all, please don't kill this bill.
All right.
And I'm saying to you, look, and listen, we kept quiet on this end because people of my persuasion, we kept quiet. So we're saying, let's let this bill go through. We don't have no skin in this fight.
Mr. Chairman. All right, we have a motion and a second to carry the bill over. All right, all those in favor of carrying the bill over, say aye. Aye. Opposed?
No.
Raise your hand. All right.
I'll do division for him. I'll do division.
I'm just kidding. All right, he's carried over. Thank you, Senator Walker. So you've heard what they said about next year.
I wish I believed it. You should. You voted for it. There are at least 3 over here who voted for it.
All right, thank you. And I think that's all we have. Let's go. All right. Hey, what's going on? He got something. Well, as soon as he said it,